Well, hello. It has been 1 week exactly since rotator cuff surgery, and I've uh, I've had 2 sessions of therapy at the therapist's office, and then of course what I do every day at the house, twice a day. Um, it's really rocking along. Things are a lot better now. I haven't had painkillers, pain medicine since Sunday. It is now Tuesday. Sunday night, I took some to sleep on, and then Monday it just seemed like it was getting better. The pain was lessening, and yay! So that's a whole lot better. And I just didn't take any. I was down to half a pill during the day. I split my pills because I just don't want to take that much. And so I split my pills during the day and then took a whole one at night so I could sleep. And that last pill I took was on Sunday night, and yesterday and today I haven't had anything, and I had therapy today. So now I did have it kind of rough over the weekend. It was kind of tough, but not horrible, not intolerable. All in all, I would say that I'm in a lot less pain, and I know a lot of you might go through something different, but I'm in a lot less pain right now than I was before I had the surgery. For at least 3 or 4 weeks before I had the surgery. That last month was awful. I couldn't get away from the pain. Um, I made a video just before the surgery, and during that video, I was really hurting. And I don't think I said anything. I told you about what was wrong, but it was hurting during that video. Right now, as I'm sitting here, I'm really not in very much pain at all. Really, I'm not in any pain at all. I feel pretty good. And I just got out of therapy. So that's wonderful. Um, Folks, you've got something to look forward to if you haven't had the surgery yet. Now, I'm not going to say it isn't going to hurt. You're going to be in pain. You're going to have some rough times, but it's going to pass. You'll have ups and downs, and you're going to learn different things you can do. I'll tell you something I learned. There's this padding on the sling. There's a big gap. I don't know if you can see it. There's a big gap right here. It's padding where it keeps your arm away from your body. Now, I was noticing I was having forearm pain. And if I would take my other hand and squeeze together, in other words, make thinner that padding between my forearm and my body, just by squeezing it with my other hand temporarily, it would alleviate that pain somehow. So I'm thinking maybe something got pinched or maybe it was a little tight, and it would help it. Now I'm not having problems with it like that anymore. I was having a lot of deferred pain. Not anymore. Um, you just have to practice with things. Do not move that arm if you don't have to. Uh, and whatever you do, don't engage the muscles in your shoulder to move them, other than what the the therapist gives you for exercises. And he's not going to have you engage. He's going to have you manipulate it with your other hand, but you're not going to engage that shoulder, the muscles in that shoulder. If you do, you could bust all that loose. So do exactly what the therapist tells you. When they say the range of motion needs to be in a painless range, they mean that. And I didn't exactly follow that the first time. And I learned that's very important. The range of motion that you do with your therapy at home needs to be in a painless range, especially for the first few weeks. So do whatever your therapist tells you to do, and you're going to come through it just fine. Um, I can't think of anything else. This is week 1 for me. Really stoked about how well I'm feeling, how good I'm doing. I've got a lot of use to this hand right now, but it's little steps at a time. So that's it. And I will talk to you next week. Do another update on week number 2. Bye bye.